an external advisor to Kheiron, and I also have the privilege of chairing their PPI advisory board. So today we're launching our PPI strategy, and you're the very first to see it. So lucky you. Over the next hour, we're going to be covering a little bit about our approach to PPI, how we like to do it at Kheiron. Then I'm going to be handing over to Nicola at the Co-Production Collective for her to talk through how they supported us with co-producing the strategy. And then for the rest of the session, we will have all of our PPI advisors presenting the strategy and the various elements of it. So our vision, our mission, and then all of the sort of subheadings of our action plan. We've got time for questions at the end, so questions for the Kheiron team or for the board. I'm going to ask that everybody saves their questions until the end, just so that we don't interrupt the flow of our presentation. But if you think you're going to forget it, you can always pop it in the chat and we'll come back to it later. Boring housekeeping stuff is just please stay on mute if you're not talking. We are going to be recording today's session, so I think Simon's going to hit record any minute. And I think that is it. So I will tell you a little bit about Kheiron. So I don't know if you've got anybody on the call. I think probably most of you are familiar with Kheiron, Mia, and the AI Award. But at Kheiron, their mission is to give patients a better fighting chance against cancer using AI that works with radiologists. So they were one of the winners of the first round of AI in Health and Care Award. And I think we're probably joined by some of the AI Award team today on the call. And that was for their algorithm Mia and sort of rolling that out into UK breast screening programs. So this strategy focuses specifically on supporting the AI Award and the UK breast screening model. So just on the right there, we've got Sarah. Sarah features in our strategy. She's our Chief Strategy Officer, and she comes along to all of our PPI board meetings to make sure that our executive team are really, really close to this work. So what is our approach to PPI at Kheiron? So we try to make all of our patient and public involvement really genuine and meaningful. And there are two very practical ways that we do this. The first is that PPI is embedded into the governance of the award. That means that we have a PPI advisory board. They meet once every quarter and they feed directly into our overarching steering group for the award and also to our executive team. So everything they say gets fed back in at that highest level. We also opt for a patient-led approach at every opportunity. So we've never produced any sort of patient materials without their input. We often use their own words and their ideas. And then the other ways that we do it that are sort of more our attitude towards it, I suppose, we don't treat PPI as a tick box exercise or something that we have to do. We really do see the benefit in speaking to these women regularly about, you know, what are their thoughts, what are their ideas, and we're always prepared to hear that we're wrong. So we don't have a fixed way of doing things when we're not consulting them. And then lastly, I feature in the strategy as well. Just a little quote from me. I think this appears on our website. Just to say that cancer has really impacted me in my life. I've had two parents, unfortunately, that have had cancer diagnosis. My dad had stage 4 pancreatic cancer and unfortunately didn't survive it. And my mum had stage 1 head and neck cancer and has thankfully been cancer-free for the last 4 years. So early detection really does make a difference. It definitely makes a difference to me and my family. So personally, yeah, very proud to work for Kheiron and very, very privileged to work with the PPI Advisory Board specifically. So a bit about our board. I love this slide because it just shows the real diverse range of people that make up our board. So we've got cancer survivors, we've got women of breast screening age, people who've got family and friends and loved ones that have had breast cancer or have a history of breast cancer. So a real range of sort of experiences from very different parts of the UK. So from as far north as Scotland, we've got people in Bristol, Nottingham, Berkshire and London. Different ethnic, socioeconomic and educational backgrounds. Together, we've got combined experience in nursing, marketing, communications, campaigning, change management, education, training, journalism, and radio. And all of those things really do make their way into our discussions and everybody's sort of diverse backgrounds and careers. So yeah, all of that insight, knowledge and experience really informs the way that we're introducing AI into the breast screening programme. And you will be able to hear from all of the members of our board today. So I'm going to hand over now to Nicola, who is going to talk to you a little bit about how we produce the strategy.
Thanks, Erin. So there's a weird echo, apologies, but I am Nicola. I'm part of something called Co-Production Collective, and we are a community of people with both living or lived and learnt experience coming together to support the co-production of research, of services, and also policy. We're based at University College London, but we are very much about culture change and challenging for change. And so we help facilitate a series of workshops that we did together with the PPI board and various other members of Kheiron's staff. And we myself and Mira, who is one of our members, community members who has herself experience of cancer, we facilitated the sessions and we really encouraged everybody present to work as a team. The values that you see on screen are really central to everything that we do, and we try to really live and breathe those values. They are what really underpin co-production and really genuine patient public involvement. And they're about being human and treating people as people, really trying to be inclusive and transparent, so open and honest about everything that we're doing, even the things that don't work, and also challenging of ourselves, being really reflective and reflexive as well, but also challenging the system for change. The sessions that we ran included about 15 people or so the PPI advisors on the board, and as I mentioned before, the Kheiron staff from different teams. We started with a really broad discussion around kind of vision and key priorities for the strategy. And then we moved into further developing these and trying to firm them up into real kind of key priority areas. So I think I'm now going to hand over to Hasina.
I think you're on mute, Hasina, still. You might need to unmute your microphone.
Yeah, hi. Tricky all the time. Okay, good day, everyone. Pleased to meet you. My name is Hasina Zuberi, and I'm a part of this organization in the role of a PPI, which is a personal and public involvement advisor. Essentially, it means that I represent Kheiron in a voluntary capacity in raising awareness of work around the introduction and implementation of AI, artificial intelligence, in the detection and treatment of breast cancer in women. Our work is spread in different countries and regions and is in its early stages. I have personally lost many of my maternal females to this disease and joined this organization at a time when one of my young female friends, who I took as a daughter, living in Africa, was going through the throes of dealing with the latest stages of breast cancer. She has since passed away, which to this day is devastating for her husband, young family, and myself, left behind to endure. I believe, had there been the existence of Mia or any form of AI, lives like hers could have been saved and or extended. So far, Mia intelligent assessment, that's the mammography intelligent assessment, is still in the formative stages and only available in select places. However, it is my vision, hope, and dream that this facility will become common use universally in the not too distant future. In terms of women checking their breasts, and why I'm going to go into why I feel that Mia is such an important part for early detection, is that breast cancer accounts for about 1/3 of cancers detected in our society. Manual examinations of breast density are usually the first go-to method a woman would use in checking for cancer of the breast. Then we have the mammogram, which performs a vital role in confirming the presence of breast cancer. With Mia, our vision is that the use of Mia in the early detection and subsequent treatment of breast cancer is safe, effective, and can be relied on for earlier and more personalized care. Presently, actually, just to add to that, my dad has been for the second time diagnosed with a cancer of sort. And, you know, we're all in a quandary. So I see that this MIA is really, really vitally important to save the type of misery that people go through or can go through, definitely do go through, when usually they detect their cancers in later stages. Thank you very much for that.
Thank you, Hussein. That was brilliant.
Let me hand over to Maura Buchanan.
Hi there, I'm Maura Buchanan, and I have perhaps two parts to me in this PPI group. I'm first and foremost, I am a nurse and I am a patient. I've been nurse, well, I'm retired from active clinical practice in Oxford 12 years ago, but I also was treated as a cancer patient 22 years ago, following a scan that gave me clearance in the middle of the year. In the December, I found the lump that turned out to be an 8 centimetre grade 3 tumour. And, you know, just no way would that have grown that size in the few months between it. So my belief is that had Mia been around 20 years ago, I think I would have been picked up an awful lot earlier. As it happened, I have had amazing treatment. I think Oxford's one of the leading places to be treated. And 22 years later, I'm still very active and just come back from a walking holiday in the hills in La Gomera. So very fit and very healthy, but very lucky. And I think Mia, if only. But anyway, to move from where we were with Hasina in looking at the vision, how we move forward towards, moving forward in that and adopting that. The mission that we need to do, we set about defining in the group with, as Nicola said, with the co-production team. And if we look at the part one, we went into little sessions and come back with all sorts of, you know, the ideas. You come back with brainstorming on post-it notes, but this is how we boiled it down at the end of the day. And, you know, the absolute focus has to be on early detection. You know, there is no doubt early detection is the aim. The early detection of a cancer means less invasive treatment. That is for patients has to be hugely beneficial. You end up with less treatment, a small biopsy, small lumpectomy, day surgery, management by maybe radiotherapy and some long-term hormone antagonistic drugs, but no major surgery, no reconstruction, no chemotherapy. I mean, what's to, you know, ask? By all means, the aim has to be very early in the stage. But unfortunately, as I say, without Mia at the minute, that isn't always going to be the case. The impact on women of later, well, I don't think anybody wants cancer diagnosis at any stage. I have to say the word cancer when it appears, it doesn't matter whether it's early or developed, but the impact in families, the impact on your work. I had 5 months off work, but a very understanding boss, I have to say. And so the idea that we could focus and get the very early stages is what Mia is really, really about. The benefits to individuals, but also if we look at the health service itself, 1 in 8 women have breast cancer. 1 in 8. Can you think of the number that is in the population? So not only is it a large number, but think of the NHS and the impact of that amount of work, you know, the workload, no matter what stage it's at. 1 in 8, the further you go into the disease, the much more complicated, much more expensive, as I said, major surgery, at a time when we've got lots of demands on NHS resources. And although I'm saying NHS here, you know, having listened to Hasina, I think there's global reach in this because other places could benefit from early detection as well, and there's possibly opportunities here for expanding Mia work. But at the end of the day, radiologists are in short supply globally. So why are we using 2 radiologists to read mammograms, which I have to say I didn't know, even as a nurse, I didn't know that. But if Mia could be used in place of to support the one that's reading and Mia as the backup, then it frees up radiologists and it also helps tackle some of the NHS workload. If we could look at the second, yeah, this one here. When we looked, that was us looking at the positive things that we needed to share with, you know, really the public, because they need to know about Mia, they need to know what the opportunities are here. But we also had to think, what is it that we need to explain to them? What are the concerns that people would have? And I think, first and foremost, it's a technology. It has to be accountable, as we say there, but it has to be safe. You have to reassure people that what they're doing isn't by any means undermining the diagnosis or putting it at risk, that it is actually safe, which is what all the rollouts are about. And also that it's not about robots. You know, this is, as I say, public type of language, that it's robots taking over, you know, what you hear in the social media and other things, that we won't have human beings, that this is to replace them somehow. Well, it's not. The radiologist will still be there, and this is about supporting and strengthening the ability to diagnose from scans. The question we had from the PPI group, will this cut across ethnic groups? Does this mean that if you're from a different ethnicity, different coloured skin, is this going to make any difference? Can we test it, and can we reassure people that it has broad reach, regardless of even the size of people's breasts, or, and as I say, different groups, and also maybe looking at cultural reasons for using or not using the facilities that are available. But most of all, as you see at the centre of that, finding the right language. We need to talk to people. AI trips off our tongues as if we actually understand it. Some of us do, some of us don't. But we need to look at the language we're using. And AI is not necessarily the expression that we would use in explaining what Mia is about. It's not about dumbing down language, but you know that we all have our own professional language, and we don't always speak in a way that other people understand it, and that's particularly true in the medical field. So we need to look at the language that we use so that we get across to the public that Mia is safe and that it's something very positive and how it works. And I think that how we're going to move forward from this mission, we're going to look at our action plan now for 2023. And I think Ali around? Ali Barnes is going to introduce the first part of the action plan. Thank you.
I'm not sure if Ali's on the call, just looking at the attendees.
Mm-hmm.
I don't think Ali's made it. Erin, do you want me to cover this part on this in Ali's absence, or do you want to cover it?
I can cover it, I don't mind.
Okay.
Yeah,
Cool.
go for it. So our action plan for 2023, we've split it into these 4 subheadings. So we had to try and make sense of all the millions of post-it notes that we'd come up with, and sort of boil them down to these 4 headings. We also discussed as a group how we wanted to stay accountable to our action plan. So things are changing all of the time, sort of the policy landscape, our priorities, our resources, opportunities that might come up. So we decided to make it a dynamic action plan. So what we'll do is we'll review this quarterly with the PPI Advisory Board, and we'll do a sort of look backwards and see what we've achieved against these goals, and then we'll also take a look forwards and say, what do we want to focus on for the next quarter? So the first heading is gaining knowledge and insight, listening to the public's views and monitoring attitudes. So this is really about being in listening mode. So the first of those actions is that between April and June, we're going to be hosting 3 workshops. We're going to be supported again by the Co-Production Collective, who were just brilliant last time. and inviting members of the public from a little bit wider, so hopefully get some people from near all of our NHS sites that we're partnering with for the AI in Health and Care Award, and base those around 3 areas of concern in particular that we identified in our literature review. So those were categorised as technological, regulatory and ethical. So as Maura said, really important factor in all of those is what language we're using and what is the right level of information to provide for different people. People aren't going to want to know absolutely everything about Mia. There's a certain level of information that they will be required to know in order to sort of consent to being to using it. And then on the right, we've got a couple of other suggested actions that fell into this category. So it's just about sort of monitoring the policy landscape as it might change. Some of their ideas were maybe scoping a study into the outcomes using AI for different ethnicities, try and reassure people. Working with different community leaders to understand views about AI in different communities, as well as some of the barriers and opportunities, gathering learnings from other behaviour change campaigns, so other things that have been quite quickly adopted and accepted, learning from how that happened, and then hosting live Q&As to try and generate some stimulating conversations with patients and the public about their thoughts. So some really great ideas that came out of our board. And I think I'm handing over to Rosemary.
Rosemary, you just need to come off unmute, please.
Oh,
Thanks.
I thought I'd tick that. Oh, such a great introduction. Thank you very much to all those who've just shared their part in this presentation. My name is Rosemary and I'm in London, and I had to take a step back. I had this idea of what I was going to say, and just listening to your stories already, I am just, it just goes to show how much breast cancer touches each of our lives. Every single person here will know someone, either breast cancer or some other form of cancer, will have been impacted by it. So just hearing you, and I know I've heard you before, but just hearing those stories coming together here right now just makes me understand even more how important this PPI board has been, and how important Mia is. So I just wanted to share that just to start off with. So, I've had my own challenges with health. So I know not cancer, but multiple sclerosis, which is completely different. But I just know how important research is to medical advancement. So, coming together and being a part of this has been really important. And I became a part of the PPI board because there was a call out for women of different backgrounds and ages to be a part of this research. So I just felt it was my duty to be able to contribute to this. And I'm so glad that I've been able to be a part of this. So all the meetings we had in a Zoom room, a Teams room last year, we had 3 or 4 meetings last year, and coming together in person this year to just put together everything that we'd thought about, what we talked about, just seeing it in action, the demonstration from Kheiron, I think it was Jonathan, who demonstrated what Mia looked like, was also impactful for me to see that. So we had this in-person meeting in January this year, so just last month, where we met each other and we came up with some, we already had some ideas on what we wanted to do and how important that public-facing information is. So just to talk you through of these bullet points, we obviously realise how important it is to reach women of all ages, cultural backgrounds, as you've already shared here, how important it is. In some cultures there's mistrust, in some communities I'm in, I know there's mistrust of health, technology, medical profession. So I know how important it is that we reach as many people as possible, as many women, well, not just women, but our partners as well are important, however we look at life, and our loved ones. So we came together when we realized that information is important to be accessible, so for all, by all, so that everybody can read it and understand it. What does it mean to them, and simplify it, not, as Maura said, not just dumbing it down, but making sure that we could all take away what we need from it, so that all the public or women impacted can take away what they need from it. So we realized that accessible information, inclusive information was important to reach all areas of all corners of our communities. Creating frequently asked questions, you know, what would deter women from being involved? We had to think about those reasons as well. Yes, why, what are the benefits, but what could deter women from being involved in having them involved in the research and being a part of MIA? So what might deter women? So we came up with some ideas, what frequently asked questions, what we could answer was important, and we came up with a wide array of those questions. Sharing stories, as you've already heard here, patient stories, how critical they are to voice in the community. You know, if MIA had been around 5, 10, 15, 20 years ago, you know, a lot of the people we've loved, a lot of the women we've loved and lost, tragically lost or impacted, their stories would be different if MIA had been around all those years ago. So this is a technological advancement that is very much needed. So hearing those parent stories is essential as well when we share our public facing information. And we've done this, we all did a video, as we said earlier, if you're reading at the top. We all were caught on camera, we all shared our side of things, just what MIA means to us and different ways of how we can voice on video, on camera, what this means to us, so that when it goes out to the community, people can see that there's lots of different women and lots of different voices, lots of different perspectives, how important that is. And giving answers as well, what our stories are, giving answers to them. Of course, we don't know everything, but we're sharing what we know. We thought of creating a timeline as well, because yes, this is another innovation. This is another incredible innovation in medical technology. And if we didn't have medical technology advancements and innovation, we wouldn't be where we are today with other illnesses and other diseases. So it is another advancement. You can't stop time. So we want to make sure that we thought that was a great idea to create a timeline of all the advancements over the years. So I won't go through all of these, but you know, as you can hear, different voices, different perspectives, essential to this strategy and to building the strategy. And as Erin said at the beginning, it isn't a tick box exercise, and just listening to everybody here, you can see that it's from love. It's well, a little bit more than love, a bit more technical and strategic, but we are real, we're human, we're living the stories, and we're sharing what we can to make sure this is received as intended for medical advancement. So I'm going to end there now because I feel like I've been on a bit of a soapbox. But and these are some of the materials that we came up with. Some marvelous answering some of the questions, you know, with posters. What might the questions be that people want to know initially, and from there, where can they get more information if they want to dive in to see more? So bright colours, you know, the breast cancer pink we've got there, some of the purples, and QR codes so people can dig deeper, and websites. So this is our story so far, and I'm really looking forward to the implementation of some of these ideas to the public later on in the year and how that's going to unfold. So thank you very much. I'll hand over to Louise Chandler.
Lovely. Thank you, Rosemary. Good afternoon, everyone. I'm Louise. Like Rosemary, I saw a message about a year ago that was sent out looking for women to come on board to the PPI Advisory Board. I've never done anything like this before. And for me, it was an opportunity to learn something new and to use my knowledge and expertise in different ways, and also to help, I suppose, combat something that, as we've heard from everyone else so far today, has got such an impact in terms of our health and how it affects those and our loved ones around us. I have a family member, a sister, who had a breast cancer health scare. So it came at a time when I was quite keen to do something to support the wider cause. And my background is in media, marketing, communications. And yeah, it's been a real delight and pleasure to be involved, really, to hear and listen and co-produce, to advise and to be a part of this journey. And the particular slide that I'll just take you through briefly now is about sharing our work with the world, because I think it's fair to say everything that we have said to each other in meetings and discussions and brainstorming is brilliant, but I think we're now at the stage where we want the wider world to know about this technology and how it's going to make a difference. And that's why it's been really important for us to start to publicly tell people about what the work is with the AI labs and with Kheiron and with Mia. So one particular highlight you'll see on there is July this year, there's going to be a patient and public report that's coming out. So this will deliver some key activities. I'll explain some more about that. But I think it's also good to highlight some of the other bullet points there that are mentioned as well, in terms of the other actions that have been taken to get the word out there and raise awareness of all the good work that's taking place. So as you can see, that includes podcasts and writing blogs, working with influencers, sharing our work on social media to start to gather some chats and conversation around that. One particular piece of work I've been involved in is an agency commissioned a journalist to write an article about the work that's going on with Kheiron and Mia. And from a PPI advisory perspective, I was interviewed by the journalist, and we talked a lot about pretty much covering what some of the ladies said already, really, about the awareness of AI and people's perceptions and how we're going to try and raise awareness of the benefits of AI and what it can do for detecting breast cancer. And I believe that that piece of work and article will be released in March and April this year to coincide with the Libra study. So it's another way of us just starting to really promote and talk about the positive work that we're doing and to invite some conversation and discussion around it. I will hand over to Erin. Thank you.
Thank you, Louise. So this is our last slide, the last point of our strategy, which is it's really important to share our PPI work with the world, but it's also very important to share our PPI work with key stakeholders and decision makers. Ultimately, our goal is to be able to start using Mia throughout the NHS in every breast screening service. And a big part of that is assuring lots of different people really that we're doing this in the right way. And one way to do that is to make our PPI efforts front and centre. So two very obvious questions when you hear about Mia is, what do radiologists think and what do patients think? Both hugely important, and we'd like to show that we are committed to bringing patients and the public along with us, and that we have already considered a whole range of views, and that we're really committed to doing this in the right way. So some of the suggested actions that fall into this category are sort of using our patient voices to speak directly to key stakeholders and decision makers. So just trying to include that patient voice wherever we can. Our group thought it would be great to set up a patient lobby group to try and influence politicians, make people aware, get this on their agenda. Working with hospitals, so engaging with PALS teams, commissioning groups, and public health groups within local councils. So just trying to be a bit more linked up with other patient activity going on. Working very closely with our clinical advisory group, so making sure that all of the clinicians that are part of that group are aware of what we're doing and what patients think, and that there's a real synergy between those two. And using patient voices at conferences, so trying to get on the agenda of upcoming events and try to show you some of the lovely people that you've heard from today and what they think of AI. So I think we're going to go into questions now, and Simon is helpfully going to sort of chair this section if anybody's got anything they want to ask us or ask the board.
Thanks, Erin. I've opened up the chat for people to put stuff in there. Jen, I can see you've got your hand raised, so over to you, Jen. If you wouldn't mind saying who you are when you ask a question, that'd be great.
Hi, everyone. Thanks for that beautiful presentation, really clear and concise. My name's Jen Carr. I work in the NHS England in the AI Award Accelerated Access collaborative team in dealing with innovations of new technologies and supporting Kheiron with Mia to help fund this agenda that you guys have got in place. I really like that presentation. It's really clear and concise, and all the supportive ladies back in this agenda. My question is, do you guys have like you've got sort of like the foundations set. Do you guys have like specific set strategies as yet as to, I mean, I know you've got like the options of using the patient voices, speaking to local gov, podcast, blogs, using social media influencers. They all sound great. Do you have like set like specific plans at the moment in place, like how you know, set in place already how you will you know, distinct specific plans already in how you will recruit these patients to support this research as yet, or is that something that's sort of still taking place? And I'm only asking from the perspective as I'm quite new supporting you guys, because I've taken over from my predecessor. So just to explain that side to me, does that make sense? Looking at you, Simon.
Yeah,
Do you
so
know that I'm brand new?
Yeah, no, so Jen, if I can paraphrase to make sure I've understood that, you're saying what are our specific plans and approaches for engaging in this work? Is that right? Or what's the approach we're going to be using?
Yeah, so I understand you've got like these sort of good ideas of how you're going to do it. And I think it sounds really brilliant. Do you have like, what's the specific set? Like, do you have days set in terms of like how you're going to recruit, or is it sort of like as and by you get people to sign up to consent to being taken part in this study?
Okay, I can give a bit of an overview, and then Erin, if that's okay to handle a few of it. So
Yeah.
we've got a couple of strands this one. So we started out with our initial PPI action plan, which we produced back in September 2021, if memory serves me correctly, which was really us almost setting out our manifesto of what we would do. And that was 11 months into the AI award, how are we actually genuinely going to set up a PPI board and hear these women's voices as part of our work. And within that, we had some very key strands of deliverables and what we would do. And then because of various delays in the award, we had to look at some of those timescales again. And that's then the work that we've been progressing. And then it will form the basis of our second report, which comes out in July this year. But I'll hand on to Erin to say a bit more about some of the key strands within that.
Thank you.
Yeah, so we did think long and hard about this, about trying to get plans in and how we're going to sort of structure it. So our next PPI board meeting is in March. So I think what we're going to try to do is under each of those headings, try and think about specific things that we want to achieve in the next 3 months. So treat it quite short term. But all of the time, our PPI advisors are emailing me with ideas and things to do. Opportunities come up, like Louise said, she was speaking to an agency, speaking to the media. So yeah, sometimes these opportunities just come up and we react. So what we're going to do in those sessions is look back and say, have we been achieving some of these things anyway, just naturally, organically as we've gone along? And then what more can we do in the next quarter under those headings to really progress us towards that vision? So yeah, trying to make it quite dynamic because things are changing all of the time. We did have a very lengthy conversation about whether we focus on sort of one strand at a time or whether we try and focus on them all at once. And that's what we came up with as a group. So we haven't trialed it in action just yet, but in March at our next meeting we will be.
Fantastic, thank you.
Thanks, Jen. Thank you for your question. Any other questions from another group? I've got one, but I'll hold back. So anyone's got others, either chat or raise your hands. Okay, I'll ask mine then. This is more actually on behalf of our PPI group. So I can, looking at the attendees here, it's fantastic. I can see we've got representation from a number of the trusts that we're currently working with. So we're working with trusts in a couple of contexts. So either doing a deployment of MIA and a service evaluation. So that means that MIA is running in the background and the clinicians are looking at it as part of a discordant review. Or the trust might be part of a formal research study. So the historic Aries study, where we are looking at historic data at Gateshead, Royal Free in North London, and Exeter in Health. And it's lovely to see two of the trusts on here from that. And that's the one around the generalisability piece. So we talked about MIA wanting to work everywhere for every woman. And that's why we're doing that sort of generalisability piece, as well as other studies as well. But one thing we've really struggled with is actually PPI engagement at NHS trusts themselves, and that's not through lack of trying. And we've got all the various connections, such as the patient advice and liaison service, so the PALS service. We've got PPI reps and things like that as well, but we've not actually had much traction. And I'd be really keen to hear from those on the call that are based at trust how we might do that. I think the silence shows just how tricky this is. Aisha, you've got your hand raised. Aisha, if you mind saying who you are and where you're from, that'd be great.
Yes, yep. Sorry, firstly, apologies everyone. I've got a bit of a sore throat. I'm Aisha, and I work with Kheiron and manage the partnership they have with Royal Free. One of the questions I think, Simon, that you've asked, and that's all splits into two in my mind, is one is education, and working with some of the trust to perhaps inform them on what specifically is required of them when it comes to patient engagement, because their idea of what is required from a patient engagement point of view in comparison to what is actually required on an AI specific project is quite different, and the sort of engagement that's required as part of that. And sometimes when teams such as PALS teams or some other teams, if they haven't worked on these sort of projects before, they perhaps aren't aware on the level of support that they need to offer or give, or what is actually required of them. So having that first step of educating trusts in a way around this is more specifically what is required and this is how we can go about it, that knowledge sort of transfer piece. And I think the second piece is, as it was highlighted in today's webinar, is having more of these sort of sessions where more people that are involved in patient engagement at trusts are invited. So again, it's that upskilling piece, so they learn more about what Kheiron is doing as an organisation on the wider PPI strategy. So when it then comes to their local trust being involved in that element, it's not something that's come out of the blue. It's something that they're quite sort of kept up to date with, and they'll have more specific questions around this, perhaps better than the partnerships and management sort of teams involved in that. I think that would be quite useful. Hope that helps.
Really helpful. Maura, you've got your hand up.
I'm just thinking that, you know, at the stage when people are in the trusts or hospitals, I'm up in Scotland, so we don't call them trusts, and I don't think that might be the time to engage in PPI. I'm thinking of myself, you know, years ago, I wouldn't have discussed, I mean, when I was getting treated, I was chairing the Royal College of Nursing's annual conference. And, you know, I still didn't, my treatment was all designed around that, I have to say, in time-wise, but I wasn't discussing it with MD. Very few people were really, would I ever talk about it? And I think that maybe at that time, people are still raw. It's all very well whether it's early or late or middle of your treat. I don't think that's keen, but I think later you might get more engagement and more willingness to engage. Now, I'm thinking of there's two, you know, specialist underwear suppliers. You know, I know that they do a post mastectomy underwear, and I think they did, I think, Marks and Spencer's at some point. It's not very attractive, I have to say. But there's two companies, and one particularly, Amina, AMOENA, and they send out a booklet on I don't know how often it is, but there are women's stories in it. There are women who have had breast surgery who are modelling, and I think they're much later down the line. They're not in treatment. I mean, you know, they've, as I said before, once you get a diagnosis that you've got cancer, it doesn't matter whether it's early or late. Well, it does matter if it's late stage, but the fact is you get that word, you don't know. Suddenly, we all live as if we're going to live forever. When, if you get a cancer diagnosis, you start to think, oh, I wonder how long that is. I mean, to be honest, my oncologist, who was fabulous, said, well, you've got a 5-year statistical. I mean, my GP went, she told you, you've got a 5-year statistical survival of 30%. Here I am 20 years later. So that's, you know, treatment has changed, and even the medication you get. So I think it's too early to engage people. They can reflect on what it was like for them at that time, but later down the treatment or later on in their life. And I think that might be where you start. And as I say, Amina does stories, women, you know, they do articles, and that might be the place that you want to think about actually writing something. I write them a story. You know, it's a kind of magazine, but they also, as I say, sell underwear, and they have people who have had surgery model. It's not just all the nice, lovely, slim beauty models that are there. There might be a lot of previously as patients. So I would have a look at that angle rather than think that you can go into hospital. It's still too raw, I think, for most people, and they wouldn't know just what they're basically exposing themselves to in the media, because you think, well, you've just to look at the stories in the press this week, where the minute something was put in the media, it was, you know, everybody and anybody piling in there. So I think that might be a fear of the media getting hold of these stories, but I think if you do it later in the line, that you might well get a bit more cooperation. That would be my thought anyway.
No, definitely. I think we need to, for particularly the workshops that we've got coming up and trying to do some engagement that involves sites, I think we've got to really think about where we get those patient representatives from. So maybe not people that are undergoing treatment currently, but people that have had breast cancer, you know, some while ago, and they feel ready to sort of contribute. And then also we need people that have never had cancer as well, because it's about going to get breast screening. So it will be a mixture of patients and sort of ordinary users of the breast screening service. So yeah, got to think carefully about who joins those. Thanks, Maura. Got a question or something coming in the chat? Didn't mean to build suspense. Sorry.
We're all watching Claire type. So what, Claire, whilst you're typing that, we'll pick up some of this on there. Hasina, you've got your hand raised.
Yeah, it's going round in my mind, ringing about this GDPR thing, and how information then is passed around in the whole of this process. I was listening to what Maura was saying very carefully, and obviously what Erin just said. I mean, not everyone is prepared at even any stage to reveal. There's still a lot of stigma attached to a lot of women, who, especially those who've had mastectomies. I have a friend that we've been friends for over 30 years, and we've just actually reconnected. She's in Leicester, and she was explaining to me her back pain is due to them reconstructing the breast from muscle or tissue taken from the back, whatever it is. And you know, I wonder how many people I haven't really gone into depth to ask her how many people she's said that to, but I still feel that there's a certain amount of kind of shame or whatever it may be for some women to admit. You know, coming to terms with it is one thing, but to share that with someone else, you know, particularly because the focus of breasts is so prominent, if you pardon the pun, in our society, you know. So those two levels is what I'm concerned about. The GDPR one, because throughout the health service, I've found myself, becoming unstuck with this GDPR. I do agree with it in essence, but I think sometimes when you're trying to help people, genuinely, especially family members in this country, and you come up against this wall, this brick wall, because it says, oh, they're over 18 or they're over 16 and GDPR and blah, blah, blah. And then the person's health deteriorates. I've personally had that in my own home, you know, so I feel like I couldn't control, and this is someone I was caring for. I couldn't really control the type of information that I got in order to do my bit, because the NHS part of it, they were blocking. So those are the issues that are of concern to me, the GDPR and the way that women may feel stigmatized, especially when they've had a mastectomy.
Thank you, Hasina.
Thank you, Hasina. Yeah, that's really valuable. And yeah, GDPR and data privacy and protection is a big thing we deal with all the time at Kheiron as well. You know, we are dealing with patient data here, albeit pseudonymized and de-identified, but there are so many things, rightly so, because we do need to protect patients' data. But it's really heartening to hear what happens when you're a carer for someone and you can't get the information you need. So thank you for sharing that with us. Claire, I see in your chat you put about interested to know what engagement we've had from the Gateshead PPI lead. Erin, you may know this better than me. I don't think we've had much in my mind, but you may tell me otherwise.
I think we reached out a long time ago, so I have to refresh my memory, but we can take it offline, Claire. I think we have reached out. I think mostly what we were sort of asking from sites at the time was that we were going to try and do some sort of workshop at each site, so actually sort of physically be there and speak to people in person. Now we've obviously changed the plan slightly, so we're going to do 3 workshops that are all online. And people can attend from any of the sites, but we'd like to have representation from them all if we can. So it would be great if we can work with Gateshead to find people that are willing to participate, that feel ready either after their sort of breast cancer or just people that have never had cancer but are interested in sort of being involved in something like this, to see if they can be part of the workshops and join the conversations. So that would be really helpful. And then, yeah, do any sort of engagement that you think is necessary. I really liked Aisha's idea of sort of using a sort of similar webinar to this to share what we're doing with our PPI work and hopefully encourage sites to get more involved in this sort of thing.
I've just put something in the chat, Paul, which are directed towards you. So about leveraging the national PPI team, because one thing we've always wanted to do from the outset is try and promote this as much as possible, because it's all well and good us doing it from a company point of view and our PPI reps as well, but at the national level, that would be really helpful. So maybe any thoughts on that one, Paul, from your point of view?
Yeah, hi everyone. It's something that I'd have to talk to the national team about, as I've not really had that much involvement with them sort of on this kind of level previously. But it's something we can arrange.
Yeah, I mean, it doesn't even have to be Kheiron specific, I suppose. If there are other companies using AI, and it wants to be a joint effort, just general AI focused patient public views, yeah, that would be really helpful.
Thanks, Paul. Any final questions before I hand over to Erin to wrap up? Okay, Erin, over to you.
Thank you, everybody, for joining us. Big thank you to Nicola for coming along and talking about her work to support us. Thank you to all of our PPI advisors who've spoken brilliantly today. You're really great advocates, and I think having you present the strategy yourselves really brings to life what the process was like for us all, and what a joint effort this is. So really appreciate your help today and going forwards, and everything you've done for us so far. And yeah, this is recorded, so I'm sure we'll share it afterwards if you think that there are any of your colleagues who would love to see it. Otherwise, I'll probably pop my email. I think it was in the slides, but I'll pop my email in the chat, and you can send me anything you want to if you want to ask about our PPI work or have some further discussions. Thank you.